Heart disease is the leading cause of death for women, but its warning signs are often subtle and easily dismissed. Unlike the classic chest-clutching image, women's heart attacks can present with unusual symptoms that appear weeks or even months in advance. In this video, we'll uncover these hidden signs so you can recognize them early and take action that could save your life. Profound, unexplained fatigue can be more than just feeling a little tired. It's a persistent and overwhelming sense of exhaustion that doesn't seem to have a clear reason. It's a signal from your body that something might not be quite right. It is a major red flag, especially when it starts interfering with your daily life and overall well-being. This isn't normal tiredness, the kind you feel after a long day at work or a strenuous workout, but exhaustion so deep that it feels like it's draining every ounce of energy from your body, leaving you feeling completely depleted. That daily tasks feel impossible. Even simple things like making a meal or taking a shower can feel like climbing a mountain. It can persist for days or weeks, lingering and refusing to go away, even with rest and relaxation. Even after plenty of rest, a full night's sleep might not make a difference. You might wake up feeling just as tired as you did before you went to bed, and often appears without any clear cause. You might be eating well, exercising regularly, and getting enough sleep, but still feel inexplicably exhausted. If you suddenly feel wiped out, even during activities you normally enjoy, and it's out of character for you, if you're usually full of energy and enthusiasm, but now you're struggling to get through the day, don't ignore it. Pay attention to what your body is telling you. Your body could be warning you, sending you a signal that something needs attention, that your heart is struggling. It's important to listen to these warning signs and seek medical advice if you're concerned. Shortness of breath, especially when it comes on suddenly or during simple activities, is another warning sign. You might feel winded just walking across a room or even while sitting still. If you're struggling to catch your breath and it's new or worsening, your heart may not be pumping effectively. Don't brush it off. This is your body's call for help. When we think of heart attack pain, we often picture someone clutching their chest, but it's important to remember that heart attack pain isn't always in the chest. It can manifest in unexpected ways, especially for women. In fact, women often feel discomfort in the back, sometimes mistaking it for a pulled muscle or general soreness. This can range from the upper to lower back, or even in the neck, which can feel like a strain or stiffness that just won't go away. It can also present as jaw pain, sometimes mimicking a toothache or TMJ disorder. Discomfort can radiate to the shoulders, arms, sometimes just one arm or both. This might feel like a heavy ache or a general feeling of unease, or upper stomach, often mistaken for heartburn or indigestion. It might be a dull ache, a subtle but persistent discomfort that you can't quite pinpoint, or a feeling of pressure, like a heavy weight sitting on your chest or upper body, or tightness, a constricting sensation that makes it hard to breathe deeply. It's important to note that it's often not a sharp pain, but rather a more subtle and easily dismissed sensation. Jaw pain, especially if it's new or unusual, should never be ignored. A persistent ache between the shoulder blades, a nagging discomfort that doesn't seem to respond to typical remedies, or what feels like indigestion that comes on suddenly and is not relieved by antacids can all be heart-related, especially in women. If you notice new, unexplained discomfort in these areas, especially if it's accompanied by other symptoms like shortness of breath, nausea, or lightheadedness, take it seriously and seek medical attention immediately. These subtle pains are often your heart's distress signals, and recognizing them could save your life. Don't hesitate to get checked out if something feels off. Breaking out in a cold, clammy sweat for no reason is a classic heart attack symptom. It's not from heat or exertion, but a sudden, chilling sweat that feels unnatural. If this happens, especially with other symptoms, seek help immediately. Sudden dizziness or feeling faint can mean your heart isn't delivering enough blood to your brain. If you feel woozy, unsteady, or nearly pass out, especially with other symptoms, don't ignore it. This could be a sign of a serious heart problem. New, persistent trouble sleeping, like waking up breathless or feeling unusually anxious at night, can be an early warning. If you're suddenly struggling with sleep for no clear reason, Pay attention. Your heart may be sending you a message before bigger symptoms appear. Many women describe a sudden, overwhelming sense of dread or impending doom before a heart attack. This isn't ordinary anxiety. It's your body's primal alarm. Trust your intuition. If you feel something is deeply wrong, act on it. When it comes to heart health, understanding the nuances of symptoms is crucial, especially for women. Women's heart attack symptoms can be subtle, often presenting differently than the classic chest pain we associate with heart attacks. But even if they seem mild, they're never insignificant. Dismissing these subtle signs can have serious consequences. If you notice any of these signs, such as unusual fatigue, shortness of breath, or discomfort in your arm, back, or jaw, especially if they're new or unexplained, it's important to pay close attention and not brush them aside. Seek medical help right away. Early detection and intervention are key to improving outcomes. Don't downplay your symptoms, thinking it's just stress or something minor, or worry about overreacting. It's always better to be safe than sorry when it comes to your heart. Trust your instincts. You know your body best. If something feels off, listen to that inner voice, and always err on the side of caution. Prompt action can make all the difference in an emergency. Share this knowledge and help protect the women you love, mothers, sisters, friends, by encouraging them to prioritize their heart health. Because when it comes to your well-being, your life is worth the call. If you found this video helpful, please like and subscribe for more health tips.